My physician and medical student colleagues, my friends, it's hard to believe it's only been a year since we met in Dallas. At that time, I spoke of the many changes facing our association and our profession. I have to admit, I did not see COVID-19 coming. At that time, I spoke of our unchanging core value, an uncompromising and unconflicted regard for our patients and their best interest, as being the touchstone by which we judge change, both good and bad. Throughout this year, I've had the privilege to represent our association from Laredo to Amarillo, from Tyler to Lubbock, and I have spoken of the inevitable need for change. Some change is forced upon us, and other change we seek out. There has been and must be change within our association. I miss my friend and hero, Lou Goodman, who continues his brave fight with cancer. But I've added a new friend and hero, Michael Darasette, who has taken the TMA family that Lou brought together and has raised them to new levels of cooperation and productivity, even as they isolate at home. We are indeed in good hands. To Michael, I say thank you for your friendship and your dedication to our physicians and their patients. In my travels, I've also advocated for our new Women in Medicine section and for the needs of our employed physicians. They are vital and growing segments of our membership. Some change is not of our choosing, but we take up the fight. Proposed federal legislation on surprise billing has provided ample opportunity to advocate for a patient and physician-friendly solution. We must continue our advocacy on this issue. As well, we have on more than one occasion made clear our unwavering commitment to the physician-led healthcare team. I've had the opportunity to visit many, I do mean many, Texas medical schools, discussing mutual concerns of advocacy and issues with many chancellors, presidents, deans, and physician colleagues. Perhaps most gratifying was the opportunity to speak with hundreds of our medical students and residents. For those who may have concerns about the next generation of physicians, rest assured they are the best and the brightest. And they're there for the right reasons. They understand the need for an uncompromising and unconflicted regard for our patients and their best interest. And then came COVID-19, an ongoing war to which physicians, nurses, and other healthcare professionals have risen to the occasion and made us all proud. Our TMA staff has done a phenomenal job in educating and providing resources, not only for our members, but for all physicians of Texas. I salute our staff for their remarkable and ongoing work. Thank you. With science and reason as our weapons, we will prevail through this pandemic. But at what cost? The strain on our economy, on our healthcare system, and on our physicians' practices, and indeed on our physicians and their patients, is immeasurable and will require years of work to repair. I know that as an association and as a profession, we are up to the task. Equally up to the task is another hero of mine, our incoming president, Dr. Diana Fite. Diana has the calm demeanor that one would expect from an emergency medicine physician, and this will serve her well in the coming days. She has my full confidence and support as she leads us through these challenging times. I would like to leave you with one last challenge for change. Our pandemic has shown a light on the weaknesses of our healthcare infrastructure and on those it excludes. Texas had 875,000 uninsured children before COVID-19. We had 5 million uninsured Texans before COVID-19, by far the most in the nation. These numbers will only increase in the coming months. I would challenge our association and our profession that as we create change, we do so in a way that will benefit all Texans, especially the least fortunate amongst us. An uncompromising and unconflicted regard for our patients and their best interests. I would be remiss if I did not thank those who made this last year possible. Most importantly, my wife and best friend Jamie, my daughter Lauren, and son-in-law Jim, my practice partners and the office staff, and my administrative assistant Michelle. Certainly all TMA staff, but especially those who helped with my presentations, proofed my blogs, and traveled throughout the state with me. I could not have done it without you. I would like to thank all of you. Please stay healthy, and God bless.